John. It's Dr. Buford here with Dr. Moore. We're just getting started on the left shoulder. We've already got our scope in the joint. We're just going to make some additional portals anteriorly. And this is kind of the biceps insertion site. Doesn't look too bad. So we're going to make our first portal right there. Hold the camera. You see the scope, can you? We examined your shoulder before we started, and you had the instability that we were expecting towards the front. Okay. We'll just flush it out a little bit. Now we'll get our spinal needle and make a second. Entry point. That looks pretty good there. Push in the shoulder, that is. So that's just above the subscapularis tendon. We'll angle down here and have a look. That's going to be a pretty good angle down on the anterior line. So, okay, pause. Okay, so here you can see the second cannula coming in. And now we're going to do a diagnostic exam. You don't need to spend a lot of time on it because we know what you have. But we do want to check this biceps tendon. See how that's a little bit worrisome here. See how that pulls back quite a bit. And in the face of your instability, we'll more than likely have to reconstruct that. Okay, so we use what we call a double loaded. Why not for that? Now we're going to look up at the rotator cuff. And unfortunately, the cuff looks pretty good here, as it usually does in someone your age. Okay, rotate around, look towards the back of the shoulder. You can see this posterior labrum's torn, so we're going to need a suture anchor back here. Okay. But what we don't see is a big Hill-Sachs lesion, which is fortunate. So we'll look down the front, and we can see that we're missing basically all of the anterior labrum here. Okay. Back around, we can see this middle glenohumeral ligament coming directly into the biceps tendon, so maybe that explains what's been going on with it. So we're going to go ahead and put the camera in the front. We'll go off on the video. Good. Okay, so you can see we've got the camera in the front. We've still got our gray cannula right here, and in the back we've placed this yellow cannula. It's called a dry dock, and we always look at the labrum to see if it's intact or not. This labrum's torn enough that I'm not comfortable just suturing directly to it, and so we're going to place a suture anchor down here. So let me see a spinal needle. Why don't you hold the gray cannula, please? Pause, please. So here you can see we've got a spinal needle coming in. You can see how it comes in right there. And we're going to place this down. Place this down into the bone, probably at about that angle. Okay, so we'll go off on the video for just a minute. Okay, here you can see we have this percutaneous drill guide. Now that we have it in, we can place it where we want, which is right about here. And Ray's got it. Jump. Right about here, and then we're going to place our drill in the guide. center anchor goes down, you can just see the anchor right there. Tap it down. Back and seat it. That feels very solid. Okay. So now you can see the orientation here. We're going to go ahead and take one suture out of the way here. There's just one there. Let me take one. Let's take it off. This instrument's called a rasp. You can see it has these sharp points on it. And we'll just take this down here and just gently abrade the capsule here. We're not trying to remove any tissue. Just want to create a good healing response. Pause, please. Do that to him. Okay, we're trying to adjust our brightness here. Okay, so here's our hook. It's loaded with a black wire called the super shuttle. You can see it coming out of the tip there. We're going to start here. We just roll our hand back. We're going to go into the capsule here. So there's our pinch, and then we'll come underneath the labrum, right there, and feed that through. Nope. Next. Okay, pause please. Okay, here you can see we're pulling back. I need a grasper. Pull that through. Okay, so what that's done for us is it's given us this first loop going through the capsule there. Now we're going to do something here called the figure of 8 stitch, which means we're going to take a pincher tool. We're going to pass that stitch one more time. Now let me show you our setup. We've got that suture passed back a second time. Now we're going to take the crochet hook and the grasper. Pause, please. So now we're getting ready for our second pass. We're going to start here, roll our hand back. You can see the first pass. We're going to separate a little bit. Pause, please. Okay, here you can see us retrieving it right here. Pause. So now here you can see the configuration. We're going to go ahead and reach in and get the partner suture here. And then we're going to tie a non-sliding knot. I'll show you some more in a minute. Pause, please. Okay, so now that we've tied the knot, this is what it looks like. It cinches everything down. It recreates that posterior band of the inferior glenohumeral ligament. We're going to debride a little bit, and then we're going to get to work in the front. Pause, please. Okay, so now we're going to use this instrument in the front of the shoulder to try and free up the labrum, and there's a little piece of bone in here too, so we can reconstruct this for you. Pause, please. Okay, I think we've got that freed up pretty well there. And just like the MRI showed us, there's a little rim of bone here. Okay, pause, please. Let me see the shaver in front of this. Okay, so here's where we're starting from. We've got the front edge of the socket debrided. We're going to take a guide and a wire and place some suture anchors down in the front now. See how it looks with this straight guide. Do you have the curve one? That looks like a pretty good spot right there. Pause, please. Okay, so here's the first anchor down. We're going to reach in and grab the suture. And then we're going to take our suture hook here. End up right here, so this is where we begin. Roll back. Show you once you get this completed, possibly. So here's a view of our stitch. Feed that through. And retrieve the relay. Pause. Okay, so there's the first one tied. We're going to put one more anchor in. You can see part of the issue is that there's just no labrum right here. And in your shoulder, even though this is a normal variant of shoulder anatomy, in your shoulder that labrum is even more inferior than normal for this variant. So we're going to go ahead and place a second suture anchor here. This one's going to come in right about here. Okay, hold the scope. Pause, please. Okay, we're going to start here again. We're going to try and pull the hammer like that a little bit. Here's what we've got in the front of the shoulder. We've got 2 anchors in. There's not really room to place a third because there's no labrum. We've got that reconstructed. We're going to go ahead and put the camera in the back and have a look at the front. Pause, please. See the double loaded. Okay, this is the biceps tendon in between the 2 great cannulas. We're going to go ahead and tighten this because I think it's going to be important to make sure we have a good hold on this middle glenohumeral ligament, given that you're missing some labrum in the front of the shoulder. So we're going to take this. You see how this just slides right down in front? We're going to roughen up the bone a little bit here. Starting to make some progress here, exposing the bone. So now we're going to get ready to place our drill guide here. Notice we're on the back side of the biceps tendon. That gives us a good angle down into the bone right here. Just like that. So we've got 2 different colored sutures to work with. We'll take the black ones. So we'll take one of the black ones here, and then we're going to take one of the blue ones here. Okay. So we have those separated now. And now the next step is we're going to go ahead and pass the suture hook through the base of the biceps tendon here. I'll show you some more in just a second. Okay, so just to show you one way to do this, we've taken the sutures out of the way on the right. Here's our hook here. We're going to reach back right behind the biceps. Poke through the base right there. Once we feed a bunch of the relay, we're going to reach in on the left side and grab it. Okay, so now, hold it here, please. Pause, please. So now as we pull back, watch, it's going to bring those sutures with it. Okay, pause. So now you can see we've got 2 sutures coming out behind the biceps, different colors, and now we're going to tie the blue and white one on the right and the black and white one on the left. So we're going to reach in here. Take this black and white one out of the way, like that. We're going to take the other black and white one out of the way. Like that. In fact, in a minute we're going to take it around behind the back. We'll show you that here. And then all we have to do to get ready to tie this blue one is get this second blue suture inside the gray canyon here. Like that. So here's our first stitch right here. Okay? Okay, so you can see the first one. The first one is tied and cut. And now we're going to do the second one. We'll get this done and show you some more in a minute. Okay, so we've got that tied front and back. There's the white one. There's the blue and white one. And as you tug on it, that's not going anywhere. So I'm happy with that. That's also helped with the stability in the front of the shoulder with that middle glenohumeral ligament having good tension on it now. Okay, so that's it. We're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.